Welcome back. You're watching McLaren Port Huron's Today's Health. And in this segment, I'm going to be talking with the Oncology Nurse Navigator, Julie Dickenson. Julie, welcome to Today's Health.
Thank you. It's nice to be here.
What is an Oncology Nurse Navigator?
An Oncology Nurse Navigator is an RN who has experience and knowledge in cancer oncology, and they will use that experience to help and guide patients, usually the newly diagnosed cancer patients, through sometimes overwhelming, confusing steps in their oncology care. So a lot of times when patients are diagnosed is when I'd like to meet them, at least make a phone call or connect with them, and then follow them through survivorship, follow them till they don't need me anymore. But when they're first diagnosed, they talk to neighbors and friends, and they have a lot of information when they come to our cancer center, or if they come to McLaren, or if they give me a call. But when they meet our professionals at Karmanos Cancer Institute at McLaren Port Huron, they're going to have a lot more information too. And sometimes they get confused or disoriented or overwhelmed by all that information. So having a contact person, say if you have lung cancer, you know they're going to have a chest x-ray and a CAT scan and pulmonology consult and biopsy surgery. So I know how things go. I know the terminology. If I can connect with that patient and make that journey a lot less rockier, so they'll have somebody they can call and talk to. I have patients calling me saying, all the time, people calling and saying, tell me about the program. And they're cancer survivors, but they still want to know. So that's important to connect with them. It's also, I want to eliminate any barriers they have to care. They may have some transportation issues. They may have some physical issues. They may need help in the home with counsel on aging or Meals on Wheels or a nurse to visit. They need medical equipment. I mean, they may need psychosocial issues, or they may need to meet with a social worker, get counseling. They may have some insurance financial issues, or they can meet with our financial counseling. All those type of things. They may have, I can't get my MRI, or I can't get my CAT scan. I mean, I can help with that coordination and the collaboration of that whole cancer process.
So is it your goal to actually get in touch with, in some way, by phone or in person, with every person with cancer, or just the new patients?
Well, I'm trying to do the new patients, because there's a lot of cancer survivors. There's 14.5 million cancer survivors out there right now. They may not need me because they've been through that process. You know, cancer treatment can last a lifetime. So they may have been diagnosed 10, 15 years ago. They may not need me, but I'm still available. I do connect with the new cancer patients, though, as much as I can.
And then how about, we can't forget about the families, because this isn't happening to this person in isolation.
No, you know, and my first contact is usually a phone call, but I end up meeting the patients' families when they come for their surgeries, like pre-op or post-op, or whether an inpatient here, if they're coming for a consultation. So I usually call them, touch base with them. Do you have transportation to the appointment? Do you have any questions or concerns? So when they do come, they'll say, hey, you're a familiar person, I recognize you, and that's when I meet the family. Now, it's not always the family. It could be a caregiver, it could be a significant other, but someone involved in their care. I mean, I would love to have every cancer patient have someone at home for support, that I'm making sure they get up in the morning, that they're eating, that they're taking their medications, that they're making their appointments. Not everybody has that, but they usually have a neighbor or a friend or somebody. I can help if they don't have that. Patients still get through treatment without that family support, but that family support is great. I mean, they come and see our doctor, like our radiation oncology patients who are getting radiation. They'll see our radiation oncologist once a week. It's a good time for family to come. They can ask their questions, write them down, answer the questions. They have another set of ears. So getting the family involved is perfect. I would love every family to be involved.
Do they need an appointment with you? Like you said, maybe you're coming to see the radiation oncologist for your treatment. Then do they need an appointment with you?
If I know they're a new patient, they're coming in to a radiation oncology, I make it a point to introduce myself to them. If I know that they're having surgery, I'll call them ahead of time, meet them pre-op, post-op. The next day in recovery on the floor, I can call them after their surgery, whether it's colon cancer, lung cancer. I call them at home afterwards. Hey, I met you. how are you doing since the surgery? Do you have any problems? So I do connect with them in a lot of different ways.
So when they want to reach you, and they call you, obviously you can't sit by your phone all the time because
No.
you're doing all these things you told me about. How soon will you get back with them?
I try to get back with them the same day, as soon as I get my messages. I mean, I can get a referral from physicians or from their offices, oncologists, patients who, you know, been through the process, knows there's a navigator. So they can call me direct. They can call me through McLaren Port Huron, through the Karmanos Cancer Institute at McLaren Port Huron. I have an email address. Anyway, I will always get back with them. I may not know the answer. If I don't know, I have a lot of good friends that know the answer. So I'll get back with them. But I would say our McLaren Port Huron staff are so involved in the community that I get referrals because they've talked to our, you know, staff, and they said to call me. So they can reach me in any way possible, and I will call them back as soon as possible.
What would you like people to know about the Oncology Nurse Navigator?
You know, the important thing is that I am there for them, for their patients. I get a lot of satisfaction for helping them, too. And I want patients to know that we're there for them, that somebody is worried and concerned about them, that they can call at any time. I mean, people call on the weekends. I check my messages sometimes during the weekend, or I'll get them on Monday and call them back. We have people calling me from Florida, from Georgia, or wherever they want to. So just know that someone's here and that's worried about them, and I can help them in any way I will.
Thank you so much for joining us today.
Thank you.
And thank you for joining us. We've given you lots of information today about lung cancer. If you have any questions about anything we talked about, or if you want a copy of this program, call us at Health Access. That's 1-800-228-1484. You know, our website is just a great resource for you, and you can also watch any segment of this program over again, and that's mclaren.org/PHTH. Join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron.